What I want to do today is talk about, Paul's asked me to talk about compassionate care, developing your own actions. So it's going to be a bit action focused, and I'm hoping to kind of capture everything that's been said today and to get you doing something. So you're going to need a pen and paper, or maybe a card. So maybe we need to hand those out as well. So let's see how we get on. And I'm hoping this YouTube clip will work. So here goes. I'll show you this film first. Made in Wigan.
I'm at the hospital. Jean's had a fall. She's still unconscious.
I've been dreading this appointment.
I hope Steve can remember me today.
You've got the all clear. That's wonderful, Dad.
We need to refer you to the surgical team for further investigation.
I just want to take her home now.
I am going to beat this.
Still waiting. It's been 3 hours now.
Going to see Dad. Maybe the last time.
Cancer-free for 7 years.
I can't take this in.
I had to deliver some bad news today.
£6 AM this morning. Yeah, he's £8.
I'm sorry, Mrs. Benson. There were complications with your husband's surgery.
So, great film, great story from Matt. I've had the privilege of working with Matt since I came into post in April, May time we met. Matt came to meet the chief nurses with Jane Cummings, and we all just sat in complete stunned silence while we listened to him, like the majority of you did today. And I've heard Matt speak since then at various many events. Thankfully, I've not followed him immediately afterwards because I think that's a tough call. But every time, I feel major emotional connection to what he's saying. And also, I feel like saying to him, I'm really sorry for that nurse who said to you, I feel personally responsible for that. And also, I can't wait to meet Nurse Tracy. Don't we all want to be her? So don't we want to bottle her and say, this is what you know, compassionate care looks like, not just for nurses, but for midwives, care staff and all of us. So Marie's already touched on the NHS Constitution, and this is a picture on our wall in work, and it's there to remind us all the time about the NHS Constitution. It isn't new, but it's a completely fabulous document to read, and it's fantastic. There's loads in there. Pledges and rights for staff, and pledges and rights and commitments for patients as well. And it is quite big as a document, but you know, there's easy read guides as well. But it says, you know, touches our lives at a time of basic human need. My iPhone cut the picture off a bit. And when care and compassion are what matter most. And that's kind of what we're here to talk about. The 60s, as Maria said, is not new. You know, Matt has said it as well. You know, it's about those 1%ers. It's about reconnecting to those values and behaviours that are there in us. They're in everybody, aren't they? They're in the, you know, Virgin Trains. I've had a great experience recently of other service industries, you know, and I just think, you know, these guys are getting it right, and we're getting it right in so many times as well. And I'm here to talk to you about the strategy which we wrap around that. So, NHS mandate. This is the document which was referred to earlier on the slide deck, and this is basically our to-do list that comes from government, and it says to NHS England from government, this is what we want you to do, okay, across England, and we deliver that through commission, and there's 5 domains, and you can see those for yourself, and it's a big tall ask. The mandate's a big commitment, and one of the commitments was talked about earlier, and there's many more in there. Again, probably a document you probably need to read when you get time. But there is also our vision for nurses, midwives and care staff. Now, I have presented about this a number of times over the last year. I've been in post for a year now. And every time I say that now, actually, if I'm not a nurse in the audience, I'd feel a little bit grieved about that. So have we any non-nurses in the audience? Non-nurses, non-midwives? Oh, the majority. Right, fantastic. Okay, well, the good news is, it may have started with Chief Nursing Officer Jane Cummings, who was the Chief Nurse here in the North. And it might have started for nurses, midwives and care staff, but what we're finding now is actually the 60s are for everyone. And that's a commitment that's been made by our NHS England board in December. That's our strategy for 14-15. And actually, you know, physios, OTs, other professionals, doctors, lots and lots of people are saying to me now, we really like how 6Cs fits. And you can tell how they fit when you listen to Matt. You know, you only need to listen to a story like that to understand that those basic 6 core values and behaviours make the absolute difference to patient care and patient experience. So the history of where it came from is from Jane. She launched it in, as a chief nurse when she came into post. It's been up and running, launched at a CNO conference in 2012. We had that in Manchester. And since then, it's just absolutely completely took off. And for anybody who is on Twitter, you can just see so much momentum gathering. And that's great for me because it's not a strategy that lives on a document in a board somewhere. It's actually, it's lived and breathed by themselves. So this is from Nathaniel Brandon, and he's an American writer who writes about self-esteem. And I'm trying to think about action here. So he talks about change. So this is your backdrop, and as Paul has mentioned, you know, there's been loads of reports, and you know, he said, you know, you've starred in some, and it's been a really tricky journey for some organisations and for some staff, and actually for nurses in general. When I hear things that are talked about in mid-staff, and I feel a personal commitment and closeness to that. So he talks about going from awareness to acceptance. So yeah, we're aware of them, but often we say, that's not me, that happened over here, that's nothing to do with me, or that's not my profession, so yeah, that's what they're like. But actually, we've got to accept that these things happen. You know, the health ombudsman reports, you know, it's a really, you know, touching read, and we must accept that these things have taken place. And then from there, we can take action. So the minute we've got to that point of acceptance, said, yeah, it happened, we're going to do something about it. And this is where kind of all your FFT feedback comes back in. So yeah, we don't get things right all of the time, but you know, we're willing to listen, we're willing to act, we're willing to do things about it. And this is our action. So this is Compassionate in Practice, our strategy document. Now the good thing about this is it's written by nurses, for nurses, with nurses. So it's not written in a language that is complex, it's written very ordinary, it's only 26 pages. So if you're going to choose any of the documents I've just talked about, this is the one. You know, it's got lots and lots of great things that we're going to do in terms of action together. And that includes you and me, it includes people at national level, it includes people at local level, it includes patients as well. So these are what the values look like. And again, this isn't Sam's version of or Jane's version of, this is 9,000 nurses, midwives, patients, care staff, all contributed to the discussion about what the 6 C's is, what it means, and actually defining them was quite tricky. So, you know, I think a lot of time and effort has gone into what the meaning of those were. And people find it quite funny when they know that I lead on the 6 C's to send me another C. So every time I get an email from somebody, they think it's really funny to send me another C. So I've had pictures of cake. Sam, the 7th C is cake. So Paul and I were judging on an awards panel not so long ago, and we got given cake. We got given the Nursing Times SOS cake. So yeah, it's the 7th C's cake. So, and lots of other things come through. So I am sure when you think about care and compassionate care, there's lots more C's you can think about. But if we stick to these as a core set for now, and I'm sure we could build a wall. And like I said, the difference of this CNO strategy to many others is that actually there's action at 3 different levels. So there's national action, so people like NHS England, DH, Health Education England and the NTDA and Monitor and CQC and everybody has signed up to the 6 C's and strategy. And they're all coming together saying, yeah, we agree with the implementation plans, we agree with what we're trying to achieve, and that's fabulous. Then locally there's action. So in your health economy, so for Blackpool, you know, how is local action taking place here between you, between the CCG, between, you know, your near hospitals, you know, for your patients and communities? What does the 6 C's action look like here? And then there's individual call to action. So what am I going to do? What is my individual action to make today? Have you all got your cards? This is where it's coming. 6 areas of action, as you can see there, and each has a senior responsible officer, and each of those are a nurse except for action area 6, which is Dean Royals, who's the chief executive of NHS employers. So providing keeping people well and keeping them healthy and independent is led by the DH, David Foster. The second is providing a positive experience of patient care. Okay, that's what everything we've talked about today. But it doesn't just sit in action area 2, it sits across, but we've got to kind of give it a home somewhere to start. Number 3 is led by Jill Harris, the chief nurse in the North, who you probably know. And she's looking at measuring impact, delivering high quality care and measuring impact. Action area 4 is about building and strengthening leadership, and that's led by Caroline Alexander in London. And action area 5 is a bit more tricky. So action area 5 has got 2 components to it. The right skills with the right staff in the right place, smashing, just what we want. And actually that's led by Ruth May, who's the chief nurse in Midlands and East, and also Lisa Bayliss-Pratt, who's the chief nurse for Health Education England. So you can see it's very collaborative in how we're trying to go about this. And providing a positive staff experience is Dean Royals. So they all come together, and no one of them, action areas, sits better with one than the other. No action area is more important than each other, and it's a bit like the C's. You can't deliver one without the other. You can be very compassionate and caring, but not doing any other communication, so they've all got to sit together. I put this up as a kind of a picture to show you, but these are all across the action areas and high-level reports, what we're trying to do. And you talked about the friends and family test here, what you're doing locally, and that's great. Okay, and what I love about what I've heard so far is there's a balance between measurement of how you're doing, but also measurement of the content of the listening, of actually making that matter. And I think that's just fantastic. So, you know, sometimes there's too much focus on, let's drive up the percentage, but actually we need to also hear those beautiful comments as well. So you can see for yourself there all the different things that are going on. So here's Jane, for those of you who haven't met her here on the right. lovely lady. Next to her is Viv Bennett, who's the Director of Nursing at Public Health England and the Department of Health, both fab. And this here is 6Cs Live, and that's our engine hub for delivering 6Cs, okay? Because, you know, as much as I love the 6Cs, I can't be everywhere, and we can't be everywhere, so it belongs to everyone, and this is your communication hub to communicate with each other, how you implementing 6Cs, what you're doing over here, can we share that, you know, what does that look like? And that is our website engine hub, but it's more than a site, it's an interactive community and a network. And there's a web address for you there. And that's when, near the time when we launched it at RCN. And this is kind of what it looks like. So it's very simple. You know, I like, you know, good click-through things to be able to see easily. So we celebrate success. We have a Twitter feed going on. Introduction to what we're trying to achieve. We also have weeks of action, which are fantastic webinars. Okay, and I'd really encourage you to get involved in those because, you know, it's great to hear about some of the action that's going on across the country, relating to the different Cs, and actually, maybe you should lead a week of action. Maybe it's something for you to think about. Or maybe you could contribute to leading the week of action. You know, when we have a week of action around patient experience, well, let's hear about what you're doing at Blackpool. So, you know, there's plenty on there. What is also on there is Stories of the Month. Here we have St Catherine's, the day therapy team at St Catherine's Hospice in Preston. So every month, and this is how I've worked more closely with Matt King, because Matt King's a panellist. So myself, Matt, Nurse of the Year, Matt Hodson, another Matt, we've got 2 Matts, and Nursing Times editor, Jenny Middleton, myself, and we've also got a new BME leader who's joined our panel as well. And we judge the stories that come in. And I know these stories here, in this room. Not necessarily, we don't necessarily need nurses' stories. We want stories about how the 6Cs is being delivered by you individually and what the impact is for that patient. So we want very personal stories of things that are going on in your day-to-day work. And you can send them in to us. So this is Story of the Month winner, I think from October. So what they did was, the idea came about when we realised that our day therapy unit was treating a higher than average number of young patients with life-limiting conditions. So, who had young children. So we wanted to take away the mystery of where their parents and relatives were coming each week. It was only natural for the children to be curious, so we wanted to welcome them by holding dedicated invitation-only events during the holidays and then on Saturdays. The themes were around Christmas and Halloween's and we used them to break down barriers with children to satisfy their curiosity about hospice care and to help them create treasured new memories of what actually is a very emotional time. And when we read these stories, you know, we need loads of tissues. So, you know, they are amazing. You know, so these are teams, they're individuals, you know, this is you, this is them, this is just down the road, isn't it? So, you know, let's hear about that. Let's feed the communications and the engine with all the fab stuff that's going on. And here's another example. So I went to Bradford District Care Trust and they invited me over and they were talking about, you know, what the nursing strategy means to them. And they featured 6Cs into their strategy. And this was just one of the quotes. It's just one of the bubbles from one of the nurses who took part. I think the nursing strategy is an exciting opportunity to embed the values agenda into all that we do in providing quality services that put patient experience first. And I'm sure that chimes with you too. So here's a bit for you. Okay, so I don't know how long I've got. We've got 5 minutes or so that we can get through some action. Alright, so this is about your action. So you can think about, you've got the choice, because I like choice. So you can either think about the top bubble or the second bubble. Okay, but you can think about how do we translate patient feedback into successful action together. So how do we do it as a we? And you can think about we as in Blackpool, Health Economy, Blackpool Trust, we as a team or as a directorate or as a group of professionals together. And then you can think about me. What action will I take to implement compassionate care in the 6Cs? Okay, so away you go, 5 minutes. Get your thinking caps on. Right, so how are we doing? Anybody want to share theirs? A volunteer.
I'll take that, yeah.
Okay.
I just wrote, I try to make all of my patients laugh or smile at least once in my shift.
Woo, round of applause. Anybody else? Come on, you're not shy in Blackpool, even I know that. So, oh, right, yeah, come on.
This is something I noticed that just happens in Blackpool, and I'm rubbish at it because we never did it in the previous trust that I've ever worked at, which is I'm going to take more time when going to meetings, just take an extra couple of minutes to get to those meetings. Be aware of the patients and visitors, their possible needs, and offer any assistance I can give them. I think as well that video where the thoughts that the patients were going through. And just sort of what I do at the moment is I'm rushing around to meetings and worrying about what I'm going to do at that meeting and my own agenda, my own deadlines, and you know, just showing patients and visitors out of the way. You know, and just, so what I need to do is actually slow down and do what they do in Blackpool, which is say, you look lost, can I help you? I'm like, yeah, I'm around and know where I'm going. And they're very good at that in Blackpool. I need to be more like that. Like I say, all the other trusts that I've been, that's not what staff do. Staff just rush around to meetings and ignore patients and visitors. So I'll try and do more like that.
Round of applause. Fantastic. I hope you got those two on film because I'm going to use these after. Anybody else? Come on. Oh, good.
As a matron in the community looking after patients with long-term conditions, I'm going to try and be a role model using the 6 C's for the community staff. And we're actually all going to look at the 6 C's as strategy and what it means towards the mission statement, because it's very different working in the community.
Absolutely is. Yeah, yeah.
Being a guest in people's houses.
Well, well done. Well done. Yeah. And I would also say, look at the community nursing strategy. So, and that's building quite a lot of momentum now with Jane. So, right, let me talk to you about caremakers. Anybody else want to volunteer before I go on? No? Okay, so, last couple of slides. So, caremakers. Who's heard of caremakers? Okay, so here we have one. And caremakers are described as inspirational boat rockers. And I'm sure there's a few of them in this audience. And what we're trying to do is, we're trying to drive through as many caremakers as we can into our NHS system, and actually beyond those boundaries as well, because care happens in so many settings. So the caremakers are on a programme at the moment which is designed and developed and supported by NHS England to take them on a journey which involves all sorts of things around leadership and learning and profiling and role modelling behaviours and challenging practice and driving up standards and being champions for patient care. And if I could just tell you that one of the caremakers, these are some caremakers here talking to Jane, but one of the caremakers came with me to speak to a whole bunch. I mean, we're talking over 100 finance directors. And he was absolutely superb. And he said, you know, I've sat here all morning and listened to you. And he said, and you know, I've not heard one word that I was looking for, and that was patient. And I was like, you know, he was just so good, because he was real and honest and open, great integrity, patient at his core in the rock that Marie talked about, so straight through, and I think that is just superb. So if any of you are looking to be caremakers, talk to Paul, because he's a caremaker, and we're just trying to drive more caremakers through the system and actually show that this groundswell strategy doesn't happen up here, it happens with you, all of you who are delivering hands-on care. So, and my last slide is please get involved. If you're not on Twitter, I wasn't on Twitter last year. Somebody taught me how to tweet, and I've now, you know, got really into it. People send me links like that one about compassion and care, and they send me papers, and I've got people who I connect with in Australia and America and all sorts of things, and they send me all sorts which help me to share some of the evidence and things that are happening. The other thing I'd like you to do and consider is giving the feedback. So you know that feedback that your nurse was talking about there on the video? Do you know, it'd be really nice to have that as a picture board, and you know, some words, and take some photos of that as still images, and then we can put all those kind of things on the site. We could even put the link to film on. So, I mean, you know, and we need to really celebrate. And I know stories are here, so please consider Story of the Month. I would love to see a Blackpool story in there. And, you know, I am on a panel, so it's everybody's view is in. But, you know, I know that I want to celebrate the great things that happen here in Blackpool. And thank you very much for inviting me. It's been a pleasure to be here.